The year was 2070, and medicine had evolved far beyond the sterile walls of hospitals. Surgeries were now performed in the personal operating rooms of licensed doctors, an innovation meant to provide comfort and efficiency. Dr. John Mercer was among the best, a surgeon with impeccable precision and an unshakable reputation. The hospital he contracted with had recently assigned him 2 new surgical assistants. They arrived unannounced one evening, dressed in crisp scrubs, their demeanor professional, yet oddly detached. "Dr. Mercer," the first one said, extending a hand. "Edward Langley. The hospital sent us to assist you with your caseload." Beside him stood the second man, tall and refined, adjusting the cuffs of his gloves with meticulous care. "Grayson Wells," he added smoothly. "We're here to make your work easier." John studied them. Their presence was unexpected. He had never been informed about new staff, but he welcomed the help. That night, as he prepped for a routine appendectomy, Edward and Grayson worked seamlessly beside him. They anticipated his needs before he even voiced them, their hands steady, their efficiency remarkable. Yet, as John made the first incision, Edward leaned closer. His voice was low, almost teasing. "Ever wonder what it feels like to go just a little bit deeper?" John hesitated for the briefest moment before shaking it off. He refocused. The surgery was a success. Still, as he washed his hands afterwards, a strange unease settled over him. Something about his new assistants unsettled him. Days turned into weeks, and Edward and Grayson became integral to John's practice. Their knowledge was impeccable, their presence constant. Edward was bold, always pushing John towards riskier decisions. "Think about it, Doc," he'd say. "You have the power to decide who lives and who dies." Grayson was more subtle, a whisper in the background. "You're an artist, John, but you're restrained. What if you allowed yourself complete freedom?" John ignored them, but their voices lingered. During surgeries, he found himself second-guessing his techniques, his hesitation growing. One night, as he removed a tumor from a patient's liver, Edward murmured, "Just nick the artery, see what happens." John's hand twitched. The scalpel slipped. Blood gushed too quickly. He scrambled to repair the damage, but the patient flatlined before he could stop it. His assistants didn't look concerned. Edward smirked. Grayson simply nodded, as if John had passed some unspoken test. John convinced himself it was an accident, but as the weeks passed, the surgeries became experimental. A young woman came in for a minor procedure. As he worked, Edward whispered, "Why not go further? See what the human body can endure." Grayson, ever composed, placed a reassuring hand on John's shoulder. "You're evolving, John. Don't fight it." John severed something he shouldn't have. The girl convulsed beneath him. Instead of correcting the mistake, he watched. Edward chuckled. "Feels good, doesn't it?" When it was over, he disposed of the body. The hospital didn't question him. They trusted his record. John stopped resisting. The surgeries turned into controlled dissections. The patients stopped leaving his operating room alive. Edward urged him on, laughing as John made deeper cuts. Grayson refined his methods, ensuring the deaths were clean, almost elegant. John barely slept. He no longer questioned his actions, until one evening, when a fellow surgeon visited his home. "Dr. Mercer," the man said. "Who are you talking to?" John turned. Edward and Grayson stood beside him. He gestured towards them. "My assistants." The surgeon's face paled. "John, you work alone." John staggered back. His heart pounded in his chest. He turned toward Edward, to Grayson. Tell him you're real." They said nothing. He looked around the operating room. The counters were empty. No extra tools had been laid out. The seats where they were usually sat were vacant. Edward smiled, slow and cruel. "Oh, John, you knew all along." Grayson tilted his head. Memories flooded him. Every surgery, every whispered suggestion. The weight of his actions crashed over him. The bodies, the missing patients, the blood-stained walls. He had done it all, and there was no one else to blame. The operating room blurred as he stumbled back. The voices weren't leaving. They would never leave. John Mercer had once been a great surgeon. Now he was a prisoner of his own mind, and Edward and Grayson would remain with him forever, whispering, watching.